Thank you for joining us today, sir, and we are really glad to have you here. But before we proceed further with this particular feedback testimonial from your end in the healthcare industry, could you please brief us about yourself and what you do?
Uh, my name is Hardayal, and it's been 2 decades I'm into healthcare. So what I do is the software part and the hardware part, both in the hospital, plays a major role. So I do take care of the entire deployment of technology, be it a software, be it hardware, or be it the integration of the entire hardware and software, both. So primarily focusing on the patient care and patient plays a major role in the healthcare. So we take care how best we can support the patient to carry their data online and on a digital format so that it is very easy for them to do all kind of a cross checkings, etc. So we have deployed multiple applications in various hospitals, be it Max, be it Manipal, be it Rockland, be it Meteor. So I have done thorough installations and been an IT head of the organization. So this is what I've been doing so far, and it's been 2 decades altogether. Yeah.
Or that was great and great insights that you gave what you exactly do and how your integrations are helping the various hospitals within the healthcare industry there. So
Yeah.
yeah, so let's get on to the questions now. What specific challenges were there with the healthcare industry client? Like what were they exactly facing with their operations, and what was your role to overcome those challenges for the healthcare operations?
See, for healthcare operations has a various challenges. I mean, in the healthcare, the verticals are different. I mean, be it nurses, be it doctors, be it paramedics, or be it the CEOs and CIOs and the management cadre. No? So, various applications have their own challenges in terms of the process flows or maybe the usability of the application, or it could be the simplicity of the application, how versatile it is to easily accessible from the for doctors or be it nurses or be it the management people. So everybody has their own ways and means of working. So in the industry we have seen the partners which we do, and for the deployment of technology
Uh-huh.
there are various challenges. The challenges are like you can say the process flows. So the application is designed in such a way that it is standard, but every hospital has its own process. So none of the hospital applications which are there, can say that it is can be deployed with no error. But the healthcare is a different ball game. So the major challenge is the deployment and then the usability. And if you don't put the data inside the application, you will not get the reports from those applications. So the amalgamation of data entry to data output, that is a major challenge. So doctors they try and they say that it is better to do a handwritten applications than of a digitization because of their time consumption. Because doctor is a valuable person and he has a lot of OPDs to do, and in the OPDs they do a lot of surgeries as well. So they are engaged in a very different way. So it's a major challenge for them also to use the application. So application has to be very simple in terms of usability of the doctors. So most of the challenges which we face is vitals, the applications where the vitals are not being captured in a proper manner
Right.
from the nurses. Yeah, you said something.
No, I just said right. I'm just taking that
Okay.
from you. Yeah.
Okay. So these are the basic things what we face as a challenge in terms of deployment. Some internet issues are there. So cost is one of the major problem in the country. I mean, wherever we go, cost cutting is the thought that they go with. That's the biggest challenge because technology comes with a cost, and that has to be adhered to. Otherwise, it is a challenge.
Right. So, coming to my next question, what exactly was your thought process basically that led you to choose Apagen services and solutions over others? Because, as per my understanding, there are many other providers basically that you could have chosen to work with. Why only Apagen you choose? What was the reason
See,
for that?
the reason is very simple because the support system what they have is amazing, and usability of the application is also I mean it's great. Be it Gaurav, be it Pratik, I mean they've been very helpful in terms of making the person understand the entire application at the time of deployment. The scopes they made it very clear that how we have to integrate, what are the solutions that they can give us, and they have almost all the applications which is required in the healthcare industry, from starting from OPD to IPD to doctors, or automation of clinics, or be it I mean integrations of lab and other things. So which we find it's very simple, and the hands-on experience with team it's amazing that we had. So that's the reason why we have chosen the company to deploy things for us. Yeah.
So, my follow-up question for this would be like, can you brief us a bit about the solutions that Apagen provided and which help you out in resolving the pain points within the hospital industry there?
See, starting from the OPD clinics, which we started up with, and automated the clinics where we can say that from the website to patients, connectivity was very simple, and it got very ergonomically designed so that people it's very easy to reach out the doctors, and doctors can prescribe them on the no go kind of way, where they can actually write their prescription in a very simple way, and the integration of the entire topology of medicines
Right.
was there in the system, and the labs and other things what we require for the integration was very simple in. So that was the reason why we started up with with Gaurav and Pratik to work along, and the price factor was also matters. So we always think that how best we can deploy the technology where we can save the cost for the patients, which they have come up with. So that's the biggest reason also, where we can see that cost effective solutions are available in the market, but people are not even aware of. So
Right.
it is, that's the biggest things that we have thought of. Then they have the solutions for OT, they have the solution for lab, they have the solution for medical things. And the best part is the inventory management system. It's very robust system that they have. So be it a barcode system, or be it a QR code, or you can say it's RFID based. It's an amazingly designed. So simplicity is the way forward for the application, where people have started using it, and it was successfully deployed.
Exactly.
So be it tech part, and be it in-house solution, or be it cloud based, and they were very comfortably helping me out to deploy things.
Right. Were there any key challenges in the implementation process? And if any were there, how did our team help with those? Could you just give us a brief about that?
IT itself in the healthcare domain, it's a challenge. Because one doctor would say something and the other doctor would say something else. So there are more than 30 plus services which is there, which we in a hospital we give, and challenges are various. So gynae would say that they have their own format of prescription writing. Dental will say they have their own format. Then the ortho will say that they have their own formats. So if there are 30 services has their 30 different kind of us templates designed for writing the prescriptions to the patients, so that it is easy for them to make their understand how their things are getting treated. So these are the challenges what we faced in the initial when we were doing the deployment. So these are the challenges what we faced on. So rest, I mean, they have a beautiful team, so they could actually take care of things. They understands the doctor's language and the nurse's language. This is more important to understand them. Otherwise, there is a big failure if they don't understand. And the team has a very fair idea about healthcare and how healthcare works. And the designed application is nicely been done so that it is easy to deploy also. And thorough knowledge is there. What I can say actually.
Right. A follow-up question would be there for the same. Were there any measurable improvements for the clients that used our solutions? Any KPIs that were made? Anything like that?
There are various things that we can actually improvise upon. Be it what you say is doctors payout, which is major thing in the industry. So the healthcare works in a different format nowadays.
Right.
The challenges are different, and doctors also has various kind of an activities to play, from OPD to operations to everything. So they have been designed that way so that they bring their own patients as well, and they've been taken care. So payout is one of the biggest thing that we can actually do, and the CSSD, which is in-house deployment of cleaning the equipments which has been used in the OT and processing them to the end user in the right time, in the right manner. So if those things can be improved upon, it would be a great help.
Right. And lastly, I would like to ask you, why would you suggest or recommend our services and solutions to others in the healthcare industry, basically that are looking forward to digitize their operations?
One is the core team that have, and based on the knowledge and the understanding of deployment of the healthcare piece, the so-called application, the HIS, Hospital Information System, and the EMR. So the knowledge based what they carry is very good altogether, and they understand the things in a of the doctors, or be it nurses, or be it any paramedic staff, and simplicity is there. So it is very easy to deploy things, and that's the reason why we will say that yes, it is recommended to have it. And they are flexible to work for on-premise or maybe cloud-based solutions, and they are flexible to choose the integration of various partners and their technologies within their system. So that's the best part. And being a open source platform, or be it globally renowned, and Odoo is altogether market player now, and they have designed and has been improved a lot in terms of things. So it is now easier for us to reach out for various different modules in a simple way. So that's the biggest thing which is there. If you talk about in a small healthcare like 500 beds or something, where you need is the healthcare information system, you need the EMR information system, then you need HR system, which is for the payouts, or be it the onboarding to exit plans, and inventory management. So as a nutshell, it's a amazing product altogether. So it under one umbrella you have the entire thing deployed. So in an healthcare, what majorly we require is the operation things, and we need the marketing part. So CRM is also integrated. So be it HIS, be it CRM or EMR, HR, all are nicely designed and deployed and integrated. So under one single click, you have the entire thing in your hand, and based on the user access and usability, you can actually get things rolled out, and simple to use as well. So that's the reason why we say that we kind of technologies to others as well.
All right, so thank you for joining us today and providing
Yeah.
us with your valuable and honest feedback for the particular healthcare industry there. And lastly, I would say thank you very much once again, sir.
Thanks.
All right, so take care. Bye bye.
Bye bye.